A single act of good can go a long way. It can cross oceans, cure disease, and create equality. As members of Rotary, we are people of action, and our actions have the power to speak loud and clear. We're changing lives and creating opportunities through our groundbreaking work in clean water, sanitation, and hygiene. Our global grants help communities create and maintain water resources close to home, because when clean water is within a child's grasp, so is a safe and promising future. We're committed to supporting sanitation projects that meet the needs of women and girls. Our programs provide modern facilities and hygiene training to cultivate long-term health and wellness. From safe access to water to private toilets and programs to teach healthy habits, we're working in homes, clinics, and schools to help families live healthy lives. Rotary Club members unite to create a world where water, sanitation, and hygiene are cornerstones of self-confidence and dignity, well within the reach of families who need it most. With more than a century of experience in service, Rotary is uniquely positioned to meet the challenges of today and fulfill the promise of a peaceful, healthy tomorrow. Your contribution to the Rotary Foundation keeps families connected to a world of good. Every gift is an action that speaks volumes across classrooms, communities, and continents. Learn how you can support the cause that means the most to you.
Good evening everybody. Welcome to the Rotary E-Club of 3310 panel discussion. My name is Chu Ban Singh, the Charter President, and I'm your moderator and host today. The topic today is about Wash, Safe Water projects. The lack of access to clean water, sanitation, facilities, and hygiene resources is one of the world's greatest health problems and one of the hardest to solve. Rotary has worked for decades to provide people with clean water and by digging wells, laying pipes, providing filters, and installing sinks and toilets. One of the biggest challenges Rotary has faced and has come about after the hardware has been installed. Too often, projects succeeded at first but failed eventually. The question is why? Today, I'm fortunate to be joined by a distinguished panel of Rotarians who will share with us their success story, and we shall learn from each other. Allow me to introduce each of them. First of all is immediate past President Jeff Yong, Rotary Club of Bandar Seri Begawan, Brunei, District 3310. Jeffrey is a benefactor, Ashklam, as well as a Paul Harris Society member. He has attained his tertiary education in Canada with a bachelor's degree in civil engineering and master's in structural engineering at the University of New Brunswick. He is a professional and chartered engineer. He received his Rotary International Service Award, Service Above Self Award in 2015-2016. And he has also received many District 3310 awards for distinguished and excellence in vocational service leadership, outstanding Rotarian, as well as service award to the Rotary Foundation. Ladies and gentlemen, let's welcome Jeff Yong. Jeff?
Thank you, C.P. Banseng, for your nice introduction. Let me go straight to my this presentation.
Hold on. Let me introduce the other speaker first.
Oh, okay, sorry.
The other speakers that we have is PDG Ganesh Bhatt. Ganesh is a distinguished civil engineering, and he's from the Rotary Club of Dawat Central. He received multiple awards, including the Rotary International Significant Award. Among many roles that Ganesh is involved, this includes Zonal Coordinator, Zone 7, Rotary India website, Vice Chairman, Rotary Zone Institute, Assistant Rotary Public Image Coordinator for Zone 5, Assistant Rotary Coordinator for Zone 5 as well, for generally speaking, National Recognition Committee members of Rotary India WASH in school from 2017 to currently. Past District Governor Ganesh has the unique opportunity to represent India during the WASH in School breakout session at Rotary International Convention in Toronto, in Hamburg, and to represent the success story of WASH in School projects in India. Ganesh. You're on mute. Thank you. Thank you. The next speaker is Heyman, past President Heyman Jagtap. He's a civil engineer by training. Herman started as a Rotaractors with the Rotary Club of Dooley Round Town. He was past president of the Rotary Club of Thani Northeast before joining the current Rotary Club called Rotary Club of Thani Premium in 2015. Among many other district roles, he was the assistant governor in 2019-2010, and Herman is an expert in WASH in school and is currently serving as a member of the National Recognition Committee. He is a zonal water coordinator for Rotary Indian Water Organization as well as Avenue Advisor Water Management for District 3141 and 3142. Under Rural Water Management Programs, which started in the year 2006-2007, to increase groundwater level, he has supervised construction of more than 440 cement concrete check dam, recharging of bore water, as well as the construction of farms. Heyman.
Good evening, friends. It's very nice to see you all on this platform. Thank you, BS, for that lovely introduction.
Thank you. The next and final panelist is my own club president, President Eddie Ho, who is also another engineer, a mechanical engineer by training. Eddie is active volunteering with various organizing, specializing in the field of water and sanitation. In his recent project, he has contributed in technical expertise in food-powered trader pumps for farming irrigation, sand water filtration, clean burning cooking stove, and rice seeding machine. Eddie is passionate about contributing his expertise in WASH project. During his spare time, Eddie enjoys adventure motorcycling, art, and traveling off to the off-beaten track to learn more about different cultures. Eddie.
Yeah, thank you, Manseng. Good evening, everyone, and it's my pleasure to be with all of you.
Thank you, Eddie. Thank you, everybody. IPDG Jeff, from my understanding in the past, equipment and facilities were usually installed properly and received well. But the local ownership, education, and sustainability were something lacking. Community often did not receive enough support to manage the project independently for the long term. Rotary have learned from these past mistakes. That's one factor, one single factor why over the past few years, Rotary have begun to shift its focus to emphasize on education, collaboration, and sustainability. Can you share with us your wisdom of what you and your club has done to successfully implement project So as you have done something like 12 to 13 projects so far, with more to come. Over to you, Jeff.
Yeah, this no, the project that we have done we have done 12 clean water projects since 2010 at the interior part of Sarawak, Upper Baram River, East Malaysia part of island of Borneo. All these projects are for the village of indigenous Punan tribe. The next slide. Okay, Punan tribe is a hunter-gatherer, traditional nomadic, live in the rainforest of the interior of Sarawak. It is only accessible by four-wheel drive, out of reach from the power grid and pipe water. They remain among the poorest and also underserved and represented the people in Malaysia. Next one. Next. Okay, many modes of transport to reach the settlement of Penang village. We normally drive four-wheel drive to Baram River, then take ferry across the Baram River, then to the Penang village. The distance travel is all depend on the weather condition and condition of a logging trail. It may take 4 to 8 hours at time. We need to use the longboard to reach the village, or even we trek for 3 to 5 hours on foot. The next slide. So this is you can see the condition of the trail, and this is the typical condition of a river, and that is we have to this right after the rain and water is no that the logging trail at time we have to wait for hours to cross the river due to the repair of bridge and so on. Next one. Okay, typical condition of river, when it's a rain, right after the rain, the water is muddy and dry weather, and the water is slightly better when it is not, but then the water is not potable. Cannot drink straight you cannot drink from the river. The villagers are always take bath, do their laundry and etc. in the river. Next one. So every project, we make sure that we have to do an assessment of the terrain and their needs. But we do a needs assessment to find out how far the water source been bring back. We even bring back the water for testing to make sure that the water is potable. To ensure that there is a water flow even during dry spell, we make sure that the proposed dam is located adequate to store sufficient water and measure the length of a pipe requirement and etc. This is what we call it sustainability. So they make sure that in a dry weather, the still of water, they still can have a pipe water. Next one. And this one, the slide, the terrain of a proposed dam site is often very high and need to climb up a steep slope. Sometimes can be very dangerous, and some proposed dam sites need to climb down to the steep slope to reach the water source. So this is how we, and in fact, for all this project we do hands-on. We either get a Rotarian to come in, or we get volunteer to come in, and all the villagers will come in and help us. We will teach them how to do the water project. Next. Okay, we often take the opportunity to render other services to other besides providing clean water. We collect useful clothing and provide dry food, water filter, medicine for the skin, stationery for the kids. You can only see the kids in the village during the school holiday. The rest of the time they are most of the time they are boarding in a boarding school in a small town. The next one. Next. Then this is what we used to do, and this is a New Zealander teachers. One trip he followed us in. They try to dressing the warm wound for the Punam people. They always get their cut. They don't have any medical attention. Next. Okay, team of Rotarian plus volunteer participate in a hands-on water project. We always stress on a hands-on water project. We get our hand dirty and get this. We try to do it in this way. Next one. So every village where we did for the clean water project, we will put up an aluminum plate sign as well as a rotary clock. The pictures here, the first, these are pictures here, the first toilet that we built in one of the village. So this is one of our public image. Now, those whoever visitor comes into the Penang village, they'll see that this village, their pipe water is provided by the Rotary, and then we'll try to go in to revisit the village and see how they are doing, and to make sure that they are. But so far so good. Next. Okay, very important that the fellowship is one of the strong pillar of our Rotary. It is important that we have fun, enjoy ourselves during and before the project. We often celebrate in Miri Town, Sarawak, before heading back to Brunei. Good fellowship is always important for a project so that we have a better understanding, build better trust among each other. Okay. In conclusion, since 2010 until 2019, the last project we did was November 2019. We have done 12 clean water projects. We also revisit some of the villages. So far, the results are very encouraging. We keep improving the method of implementation and executing the project since 2010. Based on our statistics for each project, there are 430 households and 1,850 people are directly benefited from our water project. I'm sure that the number of the household and villages of village of population are increasing due to the availability of clean water supply in a village. Thank you. Back to you, Vincent.
Thank you, IPDG, Jeff. Much appreciated. 12 projects and more to come. Since 2013, the Rotary Foundation have invested more than over 100, not 100, but 1,000 wash projects in more than 100 countries. Through grants from the Rotary Foundation and fundraising by Rotary Club, our volunteers have supported water purification, hygiene education, latrine construction, and waste management. Rotary wash projects in school, wash standing for water and sanitation and hygiene. Rotary Wash in School Challenge was a pilot project which was introduced to challenge Rotarians to develop sustainable water, sanitation, hygiene, and educational project using the expertise and resources available through two of Rotary area of focus. One, namely basic education and literacy, and water and sanitation. India and Kenya were two of the 5 countries chosen. The basic premise being clean water, better education, better sanitation, teachers training, hygiene training in schools can improve the health and education of children by creating cycle of opportunity, improve education, increase school attendance, and finally improve academic performance. BDG Ganesh, kindly share with us your experiences of WASH in school and also WASH in hospital. We all know that behavior changes is one of the most difficult to do. How do you influence shot? And also, what were your success factors? Over to you, BDG Ganesh.
Thank you, BS. It's a great opportunity to share with all of you the wash-in schools, that's called WINS, and also wash-in healthcare facilities. Next, please. Yeah, next, please. You know, it's a program of the Rotary Foundation, wash, water, sanitation, hand washing, and hygiene. For water for hand washing, cleaning, and drinking, sanitation for toilets for both boys and girls, hand washing inside and outside toilets, and also for the group hand washing, and hygiene for the girl children, menstrual hygiene management. Next, please. Yeah, as already BS has told, this is a pilot program for India, Kenya, Guatemala, Honduras, and Belize. Next, please. Friends, this is the situation of the school toilets in many countries. Next, please. See, you can experience and see the situations in school toilets. Next, please. What Rotary has done. See here. This is what Rotary has done in such schools. Change the entire atmosphere, the hygiene, and you can see the quality of even toilets and wash basins. Next, please. See the urinals here. Next, please. See the boys enjoying in the toilet facilities. Friends, along with this hygiene for toilets, we are providing clean drinking water through water filters. Next. And also, most important is the group hand washing in the schools. Together, lovingly, they wash the hands with soap using soaps and before midday meals and also immediately after using the toilets. They are adequate, they are habitants to do these things. Next, please. Yes, before going to the wash in healthcare facilities, friends, so this wash in schools provides us to increase in attendance and also to maintain it. We have an MOU with the school, see that they maintain it. The sustainability of each project is most important for us. That is why we are asking the schools to give us the quarterly report with all the photos, how they are going to maintain it, what are the financial implications, and how they plan to do such things. So this is the mostly the sustainability and also behavioral changes, my dear friends. Coming to wash in healthcare facilities, mostly four important aspects: access to clean water, improved sanitation, soap for hand washing, and very important is adequate infectious waste disposal. Next, please. Yes, adequate and proper infrastructure in wash and healthcare waste management practices. It prevents spreading of diseases within the healthcare facility and to the surrounding community. Next, please. Yeah, we have the lack of access to the pipe water 50%, my dear friends. Next. Lack in improved sanitation 33%, still long. Next, please. Lack adequate infectious waste disposal 39%. Next, please. Lack soap for hand washing 39%. So you can see, you can imagine the scope of work for us to do even in healthcare facilities. What is the global response for that? Next, please. Yes, global wash in healthcare facilities establish international partnerships and conduct wash assessment, identify the gap, recommend improvements, and evaluate progress. Next, please. Global infection prevention and control supports the development of sustainable programs. Next, please. Global emergency wash in healthcare facilities, my dear friends, is very important. Help people in complex emergencies and recovery settings like refugee camps, natural disasters, war, and famine. So, my dear friends, this is an opportunity both in wash in schools and wash in healthcare facilities. Lot of global grant projects we are doing here in India. So, I urge each one of you who are here in this program to come forward, support these global grant projects, and save the children, life of the children, and also help them to educate in a better way. Thank you very much.
Thank you, PDG Ganesh. Much appreciated. We'll have a chance to ask you a lot more questions later on. Past President Hamish, you are a in school specialist as well. But for today, I'm going to ask you to do different thing. I would like you to share your experiences and success story about check dams in India. I understand that check dams can improve environment sustainability, effective soil as well as water conservation, enable improved water supply, food security, health, and income as well. So, my friend, since you have been doing something like more than 440 concrete check dam, maybe you can give us a lot of sharing in this respect. Hamish.
Thank you. Can I have the first slide, please? Hello.
Slide.
Can I have the first slide, please? Yes. Thank you. Thank you, BS.
Okay, over to you, Hamish.
Thank you. Warm greetings and regards from my home club, Rotary Club of Thane Premium, to all the participants. Next, please. Well, the objectives of the project. We all know that the first alphabet of the word WASH stands for water, and the first important ingredient of clean water is the availability of water. So this project of construction of check dams, which has been done since many years, the purpose is to increase the groundwater table and to enable the villagers access to sufficient quantity of drinking water. Of course, not only water, but a good potable quality of water is required to be given to these rural folks. The other benefit of check dams, and the main benefit, is that it gives water for cultivation to have an alternate crop, because in these areas the farmers are dependent on only one crop. So this not only helps them for drinking water but helps the livestock also. Next. The vicious cycle. The lack of water. The people are idle for 6 months because they have only one crop to grow. They migrate in search of labor and they get exploited. And this in turn causes health and education problems amongst them. Next, please. So, Rotary District 314 and 42 have decided to do water projects. And for this, the main challenge was to convince the villagers that by having this particular project, they will be assured availability of drinking water, and that no water will enter their farms, and that this project will be a sustainable project without any maintenance required, with a life of more than 30 years. Next. Well, what are the water conservation impacts? As I mentioned, that water availability amongst 1,446 villages in this part of our districts, more than 60% villages do not get ample amount of drinking water in the months of April and May. So each check dam can store about 3 million liters of water during the monsoon, and it recharges all the open wells and bore wells, usually about 8 to 10 numbers in the periphery of, say, around 0.5 kilometers radius from the check dam. So you can say that an area of 0.8 square kilometer per check dam gets benefited because of this water recharge. Next. So out of these 422 check dams which we have completed till now, the benefit has been handed over, or more than 750 open wells and bore wells have been able to be recharged. And earlier, as the wells used to be dry in the months of March, now from the month of April and May until the onset of June, when the monsoon starts, the people are now getting ample amount of water. Next. How long does it take to boil water? 2 hours and 10 minutes in some developing countries. Well, it is an irony, 10 minutes to boil it, but 2 hours to fetch it. That is the situation in most parts of the world now. Next. So it is our endeavor to give water in the vicinity of the village. Before the check dams, women folk used to go to kilometers to fetch water. It consumed their most productive hours of the day, and it ultimately affected their health and education, especially of the school going children. Now we are, as the water is near the village, you can see in this photograph that the check dam, how it gives ample amount of water. So they can now give more productive hours to the family, give more time for their education and health. And this in turn has increased the attendance of school going children, especially the women folk. So it is a gender sensitivity design. Next. As I said, water is easily available now. Well, to sum up, I would say that in the earlier 3140 and now 3141 and 3142 districts, we have been able to complete more than 42 check dams. And not only that, we also restructure the old check dams to make them more efficient. As I said, each check dam costed us on an average about $5,000. The current cost is around $7,500. And this had helped in turn to irrigate more than 11,000 acres of land, and a total USD 150 per acre per year, 140 per acre per year is benefited. 0.2 million population is still now beneficial of this availability of drinking water, and not to mention the huge number of 6,000 cattle which gets drinking water in the months of summer. The total expenditure till date on this project is 2.14 million USD. Most of it is come from our global grants, district grants, and the CSR project. As I said, the first step towards water is conservation of water. And that is why this project has been successful and replicated. And as I mentioned, all gigantic or terrifying problems have the simplest solutions. And check dam is one of them. Thank you. Thanks for giving me a good ear. Thank you.
Thank you, Himit. Much appreciate your sharing on the check dam. For our next speaker, we have President Eddie. President Eddie, I want to ask you a question. When we were looking to our first wash, the global grant, what were the reasons you decided to adopt the experimental safe water garden project? Can you share some insight why you feel that that's something that's worthwhile to do? Thank you, Eddie.
Yes, well, thank you for giving me this opportunity. Next slide, please. Well, firstly, let me speak to you, as CP Chubanseng had mentioned, about the criteria that we used when we were looking at projects to invest and to develop with any partner. So there's 4 key criteria which we looked at. The first one, which is easy maintenance, right? So anything that we invest in, or on anything that we implement within any space, has to be simple and inexpensive. Many a times you have seen, in fact, you have seen those pictures PP Hemant had shared, and also PDG Ganesh, that almost majority of the projects that are implemented are in very rural areas, which are hard to get to, right? So the technologies that you invest in has to be very simple, and the maintenance that needs to be performed on it should be able to perform by the locals that where the project is implemented. And this should be able to be done with very simple tools, and the spares for the whether it be a pump or anything of the project, should be easily available, right? So second criteria is robustness. So the technology, whether it be a tried and tested technology or new technology, it should be solid, tried and tested. So the design of the project has to be solid and robust, right? So it should be able to take all the knocks and hits. It should be able to withstand all sorts of weathers, whether it be hot, cold, rain, and it should be able to stand the test of time, to be able to last, years and years and years. The third thing is full local ownership, right? So what I mean by that is that the end user of the project, they have to be able to have pride and ownership of the specific project, right? We have invested time and money, and they should be proud that they have such a project invested in them to deliver the expected value, right? And the last is, of course, it should deliver the expected value. And what I mean by this is that it should function as intended, right? So it should deliver the expected function. So whether it's just be, water that is piped into your home or anything of that matter. So the next slide that you see, I'll just describe a little bit more detail on the four criteria that I mentioned. So this is a schematic of the technology. So we partnered with Safe Water Gardens. So this is the logo that you see on the top right-hand corner of your screen. And they have actually developed this technology painstakingly with a lot of research. And this has been actually pilot tested in Batam, which is in Indonesia, which is close to Singapore here, which is about 2 hours away. So let me describe to you just the three components that you see there. So on the left, you have the toilet and shower. So essentially, this is where you have a basic sanitation facility. You have the toilet and then you have the shower. So all of the waste drains into the center septic tank. So this septic tank is actually buried underground, and it is made of plastic. And to the right is what you see is where we add additional value, right? So let me just describe. So when the waste flows down into the septic tank, as you know, has bacteria, right, within it, and this, through the process of bio digestion, it breaks down the waste matter into the primary components. So the primary components typically are nitrogen and water. Of course, you have some secondary components like methane and so forth, but that's the primary component is what we make use of to derive the value, right? So then, as the water flows down by gravity, as you can see from the sloped pipes, it doesn't have any moving parts. It's very simple. It's robust. Just using gravity to flow the water into the crop garden that you see on the right-hand side, right? So since one of the primary components is nitrogen, and nitrogen, as you know, it's a fertilizer. So we make use of this fertilizer along with the water, which is broken down, to fertilize any crop garden. So this could be just pure and simple banana, or any kind of fruit, or chili. And for this specific pilot project, since it was in Indonesia, and chili is a major crop there. So a lot of the project that was implemented is using it to grow chili. Next slide, please. So this technology, in fact, it's not new. It has been adopted from design from UNICEF. So it is actually a very mature technology, very simple technology, which has actually been done before, but this was adapted with additional research and development, right? So as you can see, these were the three institutions that were engaged to do further research. So University Gajah Mada, which is in Indonesia, then TUE, which is in the Netherlands, and NUS University in Singapore. Next slide, please. Yeah, so just to show you some pictures of what the components involved. So again, like I mentioned, it's very robust, very simple, just simple PVC pipes, which is available almost everywhere. And the central component, the blue cutout that you see, it's actually just a simple plastic tank, which you see widely used, for water storage, and you can actually utilize that for the septic tank, right? And on the right-hand side, you can see some of the pipes which are installed. Very simple, just simple connections, no moving parts, all fed by gravity. And the last slide, second last slide, full local ownership, like I mentioned, the user has to be engaged right from the start. So they are actually, for this particular project, the Safe Water Garden, they were engaged right from the start, right? From the construction to the purchasing of the materials. So in that way, you engage them so that they have a full sense of pride in something that you own, right? So anything that you have full ownership of, you will treat with respect and maintain it, right? And also, key point is that you have to get in buy-in from the community leaders. So typically, because this project was in Indonesia, most of the villages have a village leader. So you have to get buy-in from them first before you actually deploy the project to the village. And the last slide, which is the point I want to make, is it has to deliver the expected value, right? So again, this technology, simple technology, it does what it says, right? You provide safe sanitation in a hygienic environment, which is the toilet on the left, and then the additional value that is gained from this is fertilizing, your crop, and which is actually practically free, right? You're not paying anything for it. It is all from the waste matter. So you get crop which you can use to sell and generate income, right? So those are the 4 points, and I ran through very fast, very briefly. If you wish to learn more, please get in touch with either me or CP Chuban Singh. Thank you.
Thank you, President Eddie. We have learned a lot today that community engagement and involvement is a must for any WASH project to enjoy success over a long-term period. I have a couple of questions which I'd like to pose to the panelists, and can I invite them back? We all know that community engagement and involvement is very, very important. 2 questions that I'd like to pose to you, and maybe anyone can comment as you feel when you're ready. First of all, when we talk about global grant in Rotary, we talk about minimum size of $30,000 US. What, from your experiences, have Rotary clubs undergone or done with smaller projects, and how successful are they in implementing smaller projects below 30,000? For bigger projects, the Rotary Foundation is now very, very particular about making sure that things stays on for a long, sustainable period. And so what they are now asking us, from what I see, is that they need 10 years financial planning, which is talking about income versus expenditure, to guarantee the financial sustainability, as well as asking about the operation and maintenance plan. Can all of you share your thoughts? Can I ask Ganesh first, because Ganesh has many years of experience in WASH project, in schools, in hospital, and so forth. PDG Ganesh.
Yeah, thank you, DS. So as you have mentioned, if you want to go for a bigger projects like 6 schools, 7 schools, WASH in medical facilities, yes, $30,000+ we go for the global grants. If you for a small projects, like 1 or 2 schools, $2,000, $3,000, even up to $10,000. We have the facilities. Number 1 is district grants. Number 2 is we have the CSR, corporate social responsibility, what you call. So industries, they come forward and support. And third option is for the supporters or sponsors. So these are the 3 different ways through which we can pick up the smaller projects less than $30,000. Thank you.
Thank you, Ganesh. Heyman, I know you're a check dam specialist. Can you talk about projects that are small, undertaken by clubs, and then of course your mega project with many huge global grants that are being done? Hey, Past President Hamish.
Yeah. So it is a very important question you have asked, BS. Well, the first check dam which we did long back in 2005, the cost was borne by 50% from CSR and 50% from club contribution. But as PTG Ganesh has rightly mentioned, the smaller projects are done by clubs because a check dam costs around 7,500 US dollars now. And in our district, we have a multiple funding arrangement. Like some part may come from the district grant, about 1/3 will come from the club contribution or from CSR, and another 1/3 can come from the global grants. But if we don't go for project cost from the district grants or global grants, then also the clubs here are able to raise that much fund from fundraising or contribution from members, and we do the projects very easily. Of course, there is a small part which comes from the beneficiaries as part of the labor component, which they also help in executing. Yeah.
Thank you, Heyman. PDG Jeff, I know what you're doing is quite unique because you don't need the Rotary Foundation support. Can you share with us how you managed to raise this money and how do you do the project big and small? PDG Jeff.
Thank you, Mansen. Okay, this project normally we raise fund by ourselves from our Rotarians and also from the friends of Rotary, because of this is a very meaningful project and very easy for us to raise fund. And because of this hands-on water project, we are able to recruit more Rotarians to join us. Our membership has also grown more than double since 2010 due to this project. Many of the volunteers become our Rotarian because of they are inspired by what we are doing and they want to be part of us. Currently, our president is also one of the volunteers of our water project. Yeah. Thank you.
Thank you. President Eddie, would you like to add any comment about what we have been talking? Because we've only been participating as a participant. This is the first global grant project we are doing WASH as a club.
Yeah.
So, anything you like to say?
Yes, an important point regarding global grant. I think the Rotary Foundation is very stringent, as I've observed, and rightfully so, because they want to make sure that the money goes to the right place for the right reasons. And the question, typically, the checks that they have are very well laid out, and I think although there may be a few iterations where you have to respond and update some of your documents, but I think that if you, and that's the reason why I have mentioned those 4 criteria at the start of any project that you embark upon. So fulfilling those, definitely checks off many of the boxes from Rotary International that you will get back, to answer. So I think as we go along, like you mentioned, this is our first project, but definitely as you gain experience, you will know, what you have to complete within the project to ensure that you get a successful global grant.
Thank you. One of the things that I mentioned about what is the change of habits. The change of habit of people, number 1, using the toilet. Number 2, washing their hands. Can BDG Ganesh share with us your experiences and later on ask the rest as well? BDG Ganesh, how do you change habit?
Yeah, I think it's a really very nice question. The behavioral changes, that is the major aspect what we think and we will, inspire to go for all the students, staff, and the teachers. Whatever they learn in the school, like washing their hands with soap before midday meals, washing their hands with soap after using the toilets, and this has changed a lot. In particularly, the health system has been improved, attendance has been drastically improved, and also the admission to the schools. Earlier, those who didn't have much admissions to the schools, number of students less. Now we can see a drastic change. Here, I would like to mention one more aspect is behavioral changes in one aspect which I have seen not only in 1 or 2 schools. In India, we have done almost 30,000 schools projects in washing schools in the last 4 or 5 years, and we have seen a drastic change in all the schools, including the sustainability, the maintenance, behavioral changes, not only behavioral changes of the students, and they take it back to their home. Thereby, you can see the changes in their individual houses and also the community at large. Thank you very much.
Thank you, BDG. Heyman, sorry, Past President Heyman. What
Yeah.
about you? Do you have to change people's habit?
Yes, yes, yes. Now, as Pritiji Ganesh has explained, the basic objective of WINS, that is washing schools, is to implement the project to make a behavioral change in the students. Because we always say that if the students get into good habits, they in turn at their homes try to tell their parents, their siblings that yes, this is the way we should wash the hands and keep ourselves clean so that we get good health. So it is a behavioral change which is much more required in WASH. Of course, because of the check dams, we have observed some behavioral change in the eating habits of our tribal population because as now they grow more green vegetables, they grow more nutrient foods, their health has also increased. Thank you.
Thank you. PDG Jeff, can you share with us your experiences about changing habits?
Changing habit.
Yeah, changing habits, washing hands, making sure that they use the toilet and not just do whatever their business anywhere they feel like doing.
In fact, if you look at them now, once they get the water pipes into village, they're so happy about that. There's a pipe water in the village. They can wash their things in their house instead of in a river, and then they can wash all their clothing and they can bath in the house instead of outside. So that is a big difference, big changes, and the water is clean instead of using water, this river water.
So for you, it's not so much of a problem, right? From your experience. Eddie, I think you want to share about one of the biggest concern is about stunning in Indonesia. And the fact that some people, even though you have built the toilet, they may not use it and they may continue to do what they are using. Can you share with us what was the challenges faced when we look at implementing this project, Eddie?
Yes, most definitely. It is a behavioral change because many of the villages within Indonesia, they still practice open defecation. And this, like you mentioned, causes many diseases because of the contamination of groundwater or the outflow into the river. And this causes diseases for the young children, and that leads to malnutrition due to those diseases, right? So I think this is a key uh, factor to either totally eliminate or at least reduce it to a certain level, is to have this implemented within the village community itself. And if not one to each house, at least 3 or 4 households can actually share this toilet facility, right? So I think this is again a vast improvement for them, because you don't have to find a space to have to defecate, and especially for the girls, they are a bit more safe, because they don't have to go out and and face the challenges of their safety. So I think with this implementation, and we want to have, along with our Safe Water Garden partner who has actually developed the technology, we want to launch it throughout. Initially, of course, we have already completed the pilot in Batam, like I mentioned, but throughout West Java, within the Citarum River, which is highly polluted. So this will definitely help to improve that situation, and eventually our vision is to roll it out throughout the country within the rural communities.
Thank you, Eddie. Much appreciated. Well, we have got a lot of sharing from everybody, and we think that we have learned a little bit more about WASH projects. To round it off, I would like to ask one last comment from each of the panelists. Can I start with immediate past District Governor Jeff Yong to share a minute on about what he has to speak to us, and a word of wisdom. Jeff Yong.
Okay, for this project, the main things we learn is one is the teamwork. We build our teamwork among our Rotarian. Secondly, because we do a hands-on project in the jungle, then we tend to build a better bond together with a volunteer, then so that we can and these people get so inspired with our project, and then become our Rotarians. They become part of us. So this is how we have recruit so many members in the past. Since 2010, we have recruited more than 10, probably 20 of this Rotarian from the volunteer.
Thank you. So hands-on will bring in more members, right? PDG, Jeff Yong. PDG, Ganesh, would you like to share with us your word of wisdom when you are involved in WASH project?
Yeah, first I would like to answer to President Eddie. The washing school projects, most of them are through global grants, and I'm very happy to share that almost all the districts, they are 100% compliance in reporting and other things. That is why we are receiving more and more global grants in India. Number two, of all the projects in washing schools, we can see the drastic behavioral changes in the students. Number two, improvement in the health of the students, and very importantly is the basic structure and infrastructure of the school is totally changed. And in washing healthcare facilities, we can see the improvements in the health hazards, particularly the staff within the staff, and also the spreading of the disease in the community is reduced to a lot of extent. So my humble request to each one of you here is to come forward Let us strive hard and work more to improve the situation of the students and health of the students for the promotion of the health as well as for the literacy by going for more and more global grant projects around the world where it is necessary. Thank you very much.
Thank you, PDG. What about you, PP Heyman?
Yeah. My last word would be that we all know that water is the elixir of life. Without water, nothing is possible. And in WASH, we are not only giving water, but we are giving good potable quality of water. And it will turn as a good asset to the community, because we all know that health is wealth. And in the current situation of the pandemic, it has got more and more importance. My club, Rotary Club of Thane Premium, is ready to give or participate in global grants in any parts, and would request the present participants. And we will also be able to receive the grants and give the grants also with all the technical expertise needed for the execution of the project. Thank you.
Thank you, Heyman. President Eddie, your last words.
Yes. What I like to say is that, from all of the WASH projects that I've been involved in, the technology is very simple, and it exists. It's nothing that is, rocket science. The only thing is, we have to get it implemented and we have to get it out there, right? So it all depends on, our ability and our contributions to the global grant, and, partnering with different Rotary clubs and third-party organizations to get it implemented, right? So I look forward to all of you, the audience that are out there, to, put your support, contribute to our global grants so that we can get more projects out there to help, all of the communities that are lacking in the WASH facilities. So thank you.
Thank you, President Eddie. Thank you, Past District Governor Jeff Young, Past District Governor Ganesh, Past President Heyman, and Past President Eddie. I think all of us has a wonderful session today to learn from each other, and I'm sure that the public has also had the opportunity to learn from each other. WASH project is a very important project. It encompasses two areas of focus in Rotary. And if you have any problem and you want to know a little bit more about WASH project, well, here are the resources that you can connect with and try to get your answers. So ladies and gentlemen, don't forget, Rotary is a family. We are people of action, and we are ready to serve and to answer whatever questions you need to know. So thank you very much, and we'll see you at the next panel discussion. Bye-bye.
Bye-bye.
Bye-bye. Thank you. Thank you, everybody. Thank you. Thank you.